everyone, this is Elise Kleckner. I am doing my flashcard presentation for septic shock. So the disease process. Septic shock is actually the last stage of sepsis. It's not something that is completely separate from sepsis. It's the most dangerous and life-threatening type of sepsis, and it uh, it's considered to be a subset of sepsis in which underlying circulatory, cellular, and metabolic abnormalities contribute to a greater risk of mortality. There are three separate stages of sepsis. The very first stage is when the body is overstimulated and overwhelmed because of some type of, infection or disease process. The second stage of sepsis is called severe sepsis. This stage is now causing the body's organs to malfunction. And the final and most deadly is septic shock. So this is when the organs actually begin to fail. Next is the pathophysiology of septic shock. So sepsis is a clinical stage that falls along a continuum state and starts with systemic inflammatory response syndrome and ends with multi-organ dysfunction syndrome before death. Risk factors, there's two types, so modifiable and non-modifiable. Modifiable would be having an unhealthy lifestyle. So this could be anything from hygiene or the type of food that you consume. And it can actually make you immunocompromised, which then makes the body more susceptible to infection and then in the process developing sepsis. Diabetes. So if it's diabetes type 2, obviously everybody knows that this one can be preventable or even reversed if it's not too far along. So this means having a healthy diet, exercising, taking the medications that you're supposed to be taking as prescribed. Non-modifiable would be extremes of age. So babies, infants, toddlers, or the elderly are more susceptible because their immune systems are lower than a healthy young adult. And then, like I stated above, immunocompromised people. So having a low immune system gives you an increased risk of developing infection, which then can lead to sepsis. Signs and symptoms. Signs, tachycardia, extremes of temperature. So high temperature or very, very low, having irregular heartbeat, and then cold or pale skin. All of this is from not having proper circulation. Symptoms. So this is what the patient might actually be feeling. Chills due to the high or low temperature, shaking, being disoriented, shortness of breath, over breathing, so hyperventilation, being sweaty, or hot and clammy skin. Diagnostic tests to help confirm sepsis or septic shock. We would want to order blood work, so CBC. We would want to test the oxygen that's in the blood, checking for any dysfunctions of the organs, chem panel and lactate, trying to figure out what type of bacteria is actually present in the blood so that way we can give the proper antibiotic. Urine samples, possibly a spinal tap, MRI, CTs, or X-rays. And that concludes my presentation. Here are my references. Thank you. I hope you guys enjoyed.